Good afternoon, all from the Gulf and surrounding area. This is WL1.7 today. In local news, the Jackson Police Department is investigating after a child died during a shooting at an apartment complex. 3 adults were injured. The shooting happened just before 9:30 p.m. on Wednesday at Wood Village apartment on Wood Village Drive. The adults and the child were injured after bullets entered the apartment unit. The child, who has been identified as 5-year-old Kenyatta Davis, later died at the hospital. The other victims are expected to recover from their injuries. Police said a possible suspect has been identified. Mayor of Jackson released a statement about the deadly shooting. "I mourn the loss of every innocent life. It is especially heartbreaking when lives are taken due to senseless violence. As a father, I'm further devastated when we lose a child in our community. I offer my deepest sympathy and sincere condolence to the parents and loved ones of the 5-year-old whose life was senselessly stolen last night. We must develop better ways of resolving conflict than resorting to acts of violence. The permanent outcome to these temporary disagreements is beyond devastating. Please join me in praying for my family and community of precious Kenyatta Davis. I commit to fighting to ensure her life was not lost in vain." This is the second child shot to death this month. On April 6th, 11-year-old Jordan McCoy was killed in his home on Forest Avenue. In other local news, the Mississippi Emergency Management Agency continued to respond to the severe weather that hit the state on April 12, 2020. The total number of confirmed deaths remained at 12. At this time, 33 counties have submitted damage reports to MEMA. Over 1,200 homes have been impacted statewide by Sunday's severe weather event. Additionally, over 75 businesses across the state have been impacted. In national news, thousands of medical workers in the U.S. have been sickened by the coronavirus, but the official number falls short of the virus' true toll. According to a new report from the Centers for Disease Control and Prevention, the recent surge of COVID-19 cases and deaths in parts of the U.S. paired with a dire shortage of medical supplies such as masks have prompted concern that the country's physicians, nurses, and other healthcare workers are being left unprotected and even more vulnerable to infection as they battle the virus on the front lines. And as the coronavirus spread in more communities across the U.S., the numbers of healthcare workers who fall ill is expected to rise. The new report says of April 9th, at least 9,282 healthcare workers in the U.S. had COVID-19, and at least 27 had died. According to the new report, however, that number is almost certainly an undercount because researchers only knew whether a patient was a healthcare worker in 16% of all U.S. coronavirus cases, which had reached nearly 400,000 by April 9th, leaving 84% of cases unaccounted for in this report. We know that healthcare workers are not only getting infected, but because critical ill and dying from COVID-19, said Dr. Alice Hancock, an assistant professor at the Baylor College of Medicine and an emergency physician in Houston. Tracking it is the only way that we are going to be able to prevent it in the future. While incomplete, the new figures offer the clearest picture yet on how many healthcare workers in the U.S. have been affected. 2 weeks ago, U.S. News contacted all 50 state health departments or coronavirus response teams to ask how many healthcare workers had COVID-19. Many were not tracking that data, and others weren't publicly reporting it. The CDC also did not respond to a U.S. News request for data. The news report showed that among infected healthcare workers with data availability, 73% were women, and the median age was 42, reflecting those distribution among the healthcare personnel workforce. About 72% of these healthcare workers were white, and 21% were black. More than half these workers had only been exposed to the virus in a healthcare setting, but it's unclear whether those infections were caused by contact with a patient, visitor, or other healthcare person, or whether these healthcare workers were wearing personal protective equipment. The report said the PPE shortage are very challenging. We are reusing things that we have never had to reuse before across the country. And so I think it's important to know if that putting us at a high risk or not. The majority of infected workers showed common symptoms like fever, cough, or shortness of breath. Through the report notes that healthcare workers were mild or sympathetic infection might also have been less likely to be treated, thus less likely to be reported. While most of the infected healthcare workers were not hospitalized, 184 were admitted to an intensive care unit and 27 died. Just 6% of the patients were 65 or older, but 10 of the deaths were among these older adults, and 38% of those infected had an underlying medical issue. The report found tracking with other data that shows the virus is most dangerous for older and sicker people. State leaders and healthcare organizations should consider the risk for older medical personnel as they move to mobilize their retired healthcare workforce to treat a surge of cases. The report says, for example, these workers could be prioritized to work in lower risk settings such as telemedicine or clinics for non-COVID-19 patients. Other national news, a 4-year-old boy who is battling brain cancer in New York cannot get the chemotherapy he needs because he has tested positive for COVID-19. Jennifer Ferruzzi of St. James said she thought her son Mateo had a stomach virus when he started feeling nauseous last month. She became more concerned after he developed other symptoms like abnormal eye movement. The mother rushed her son to Cohen Children's Hospital in Queens, where the doctors diagnosed him with a malignant brain tumor. I didn't expect to get this diagnosis, Ferruzzi told News 12 Long Island. The young boy underwent emergency surgery to relieve the pressure on his brain and was sent home to recover before he could begin chemotherapy. That's when things got more complicated. Mateo's mother contracted COVID-19 and he had to self-quarantine. It was hard for me to be in the bedroom so sick and hearing him out there, not being able to tell him, "It's okay, mommy." Here. She said Mateo later tested positive for the virus as well, which has delayed him getting the life-saving treatment he needs. It's such a crazy time for the whole world. We all in a crisis, Ferruzzi said. The best time I can get a good cry in is when I'm in the shower. Ferruzzi is now praying that her son's next coronavirus test will be negative, so he can finally start chemotherapy. The mom is also sending a message to other parents during this difficult time. If your child is showing symptoms or complaining about something, absolutely get them into their pediatrician right away. And even if it's nothing, it is better to be safe than sorry. As of today, it is expected to be a little sunny with a high of 71 degrees and a low of 48 degrees. This has been your daily news update brought to you by WPR 91.7 FM. We now return you to your regular schedule programming. The Alcorn State University COVID-19 spring hours. Brunch box and lunch hours is from 10 o'clock a.m. to 1 o'clock p.m. Dinner hours is from 4 o'clock p.m. to 5:30 p.m. Due to public safety, this is a cash-free zone and only gold card with preloaded meal plan funds. Cash or credit will allow entrance to the dining hall. The Mississippi State Department of Health is reporting 264 new cases of the coronavirus COVID-19 in Mississippi. That brings the state total number of cases to 3,624 with 129 deaths. New cases reported today, 264. New deaths reported today, 7.